Our first speaker today is somebody I've known for quite a long time, haven't I, Kerry? Um, so Kerry is an amazing lady who has it started as a specialist nurse, well, a cardiac nurse, ITU nurse, worked through Great Ormond Street and came up to Birmingham. She is an academic. She has heralded the needs of people with congenital heart disease, and we've had quite a bit of focus on single ventricle heart disease over the years, and we've partnered Kerry with a great deal of her research over the years. She has risen to the dizzy heights of being the professor of congenital cardiac nursing at Birmingham University. I can't tell you how proud I am of her for doing that, because this is the first professor of congenital cardiac nursing in the UK, and we are very, very lucky to have her speaking for us today. She's going to talk about the symposium that we ran last year, update you all on what the aims of the symposium was and the outcomes from it. Kerry, over to you.
Thank you. Right, I'm just going to share my slides.
Joy, can we take this one down?
So just to check you can see that. Yeah. Thank you very much, Susie, for that lovely introduction. And thank you for inviting me to do this presentation at the beginning of your Open Day today. I'm really delighted to be with you. I have been to several of your previous Open Days, and they're always really informative, great days. And actually, for me, it's really important meeting patients, young people, children, families at these days, because that's why we're all here. So I'll crack on, because we've got a tight time schedule. And as you said, Susie, I'm going to just be giving you the feedback from the National Symposium that was held in September last year. So just to start, this is a picture of the faculty. So we were the organising team for supporting Susie and Little Hearts Matter, and also speakers on the day as well. And the day was, as I say, held in September in Birmingham, and the focus of the day was led by the priorities of yourselves, the LHM members and patients. And we were looking at living the best life after the fontan. So the goal of the day was to bring together healthcare professionals from across the country, and so that we could think about the way that we help support young people and their families living after the fontan operation. So thinking about medical and lifestyle challenges. And we did that through short lectures from these speakers that you can see here, and also then kind of roundtable discussions afterwards. So the participants were doctors, nurses, psychologists, allied health professionals, so physiotherapists, speech and language therapists. We had a really wide range of professionals during the day, joining us during the day from, as I say, from every network. There are 11 networks across England, across the UK and Ireland. And we had representation from all of those networks, which was absolutely brilliant. So these were the key topics. You can see here a very full room, which was amazing and it's really great for us as well as professionals to get together and have an opportunity to get together and talk about care for our patients and families. So these were our key topics, a long list of them. I'm not going to read through that list, but I think you can see from the list, and I believe you'll get a copy. Well, it's recorded, isn't it, this Open Day, so people can go back and have a look at the slides in more detail and read through those, because this will be a bit of a whistle-stop tour this morning. So you can see that we looked at all sorts of different things through quality of life, some of the challenges in terms of education, exercise, vitally important, really important, thinking about sexual health as well, and transition from children's services across into adult services. palliative care, transplant, and then fontan clinic. And we also talked about research and how could we continue developing research studies and then implementing the findings of research studies for you, for your benefit and benefit of professionals as well. For me, this is the kind of most important aspect of the day. We had patient stories throughout the day about each of the different topic areas, and it's really crucial for us as healthcare professionals to hear the voice of the patients, so whether they're children, young people, adults living with single ventricle, and also, you know, the feedback kind of from a parent perspective as well and wider family, because it's really humbling for us as healthcare professionals, but it really helps us to think about what we're doing and how it actually is beneficial for the people that we're doing what we do for. So, and this was a quote from one of the delegates on the evaluation form about, you know, continuing to get that patient voice through. So what I'm going to do now is I'm going to go through some of the key themes, and on each of the slides are quite busy. So again, I'm not going to necessarily read through everything on each slide, but each of these slides gives you details about the pathway and the items that we discussed within our small kind of discussion tables and things that we identified as being really important during that pathway following the fontan operation. So one of those was around medical care and thinking about how could we start the discussions right from antenatal clinic, right the way through the lifespan, and through that patient journey. So thinking about making sure that parents got a clear understanding before they make a decision at those antenatal clinics, making sure that we are really clear for parents and we give them a lot of information, that we introduce Little Hearts Matter early, because that's essential, isn't it, really, having that support. And then things like optimizing health, discussions that we might have after the fontan surgery, talking to patients themselves, young people, about the risk-taking behaviour that is normal kind of adolescent risk-taking behaviour, but the impact of that from a single ventricle perspective. And also, crucially, thinking about other healthcare professionals outside of the specialty of cardiac, so your general practitioners, for example. In terms of exercise, there's been lots of work taking place around exercise for all children, young people that have got congenital heart disease, but particularly thinking about the single ventricle group. And so we know that we need to really raise the profile of exercise from a very early age so that patients and families understand the importance of exercise and that we've got this positive kind of support of physical development both before and after surgery, and that kind of can-do attitude. It is okay for me to do exercise. We want to encourage exercise champions across each of the CHD units, actually prescribing exercise as well, and then also thinking about the education that we give around exercise. Neurodiversity, a really important element for us to make sure that parents very early on understand that there are neurodiversity issues in some children with single ventricle, so that, you know, we're really open and transparent about this right from the very beginning, making sure that the mindset from a clinical perspective is to make sure that we maximise the potential of every child and that it's not an afterthought. That we have education and assessment tools available, and that, again, coming back to that wider kind of healthcare professional, making sure that health visitors really fully understand the implications of a single ventricle. So we're supporting our colleagues out in primary care as well. And then that there's assessments throughout the life stages, and then later on thinking about employability. Psychology support, I think you've got a workshop with Michelle around this as well later, so that will be really great. Picture of Michelle there as well. So thinking about universal parenting support at every stage throughout the journey, making sure that we engender resilience, coping skills, and we think about post-traumatic growth. There are screening tools that we can use. So we want to introduce network standards across NHS England, and really making sure that the mental health support is available for patients, for the parents, for their siblings as well, grandparents as well. There's research around that. It's really important that we think about the wider family. And that also looking at that during transition and thinking about signposting as well to other mental health resources and services. Sexual health, really important aspect, and sometimes quite awkward to talk about, particularly, you know, as you're going through kind of as children are growing into young adults and you're having those conversations with the healthcare team. So these, you know, they can be tricky conversations, can't they? But we know that it's really important. In school, children have the sexual health education teaching around relationships and things, and it starts at secondary school. So we want to make sure that what we're doing clinically is aligning with that national curriculum. So starting from the age of 11, but making sure that the conversations we have are age appropriate. And that we as teams, children's nursing teams and healthcare teams in the children's centres liaise with our adult teams, and that we work together in a joined up way to make sure that we're empowering that transition across from child to adult services, and that we're giving the right information about sexual health, pregnancy, family planning. Really important that we have those conversations with both the females, males, or, you know, across all genders, that there's an opportunity to talk about sexual health, and about relationships and the implications. Making sure that the information that we have available is appropriate, and that we're improving that information all the time, and that actually we need access to education and training as well in these areas as the healthcare professionals that are giving that advice. I know Susie's done a lot of work around benefits, and that came up, and there was a whole pathway that we talked around here about raising the awareness of benefits, and writing some top tips for medical teams, but there's lots of further work that needs to be done here to help medical teams to understand the responsibilities. And as I say, that's a piece of work that's happening at the moment, and lots of work happening there. And then transition, and this is a crucial time, isn't it? Because, you know, you've had all of those years within children's services, getting to know the children's teams, and building up really strong relationships through that child journey with the teams in the children's hospitals, and moving from children's hospitals across into adult care is a time that's probably fraught with anxiety, because you're moving from a place that you know to a place you don't know, with a team you don't know. So it's really important that we get the transition pathway right, and there's a lot of work that's still needed here, I think. So building relationships, making sure that transition is youth focused, that Lexi's doing lots of work around this, having transition events, putting plans in place, making sure we remember neurodiversity, that our staff are appropriately educated and trained as well around transition, that the communication channels are really clear, that we include parents. You know, parents have been there through that whole kind of journey with their child through into adulthood, and it's really important to remember them, and also that the adult teams remember the journey that the parents have been on, and supporting right through across, you know, from childhood into being a young person and into your 20s. Transplant, we talked about when should we talk about transplant, and we felt that this was really important right at the antenatal scan, that we were realistic about survivability, that we prepare families for heart failure and the signs of heart failure and recognising those, that heart failure pathways include early referral for a transplant discussion, that palliative care is part of that conversation, And really important communication across the networks, and that those transplant teams are multi-professional, including lots of different professional groups, dietitians, palliative care, psychologists, physiotherapists. And palliative care, that we normalise this right from antenatal, from those conversations at antenatal clinics, so that it's a conversation that's happening all the way through the journey. That we have better understanding about that, so professionals have better understanding about palliative care and when to refer, and that the teams are available all the way through the journey, and all the way through that fontan pathway. That we need to look at the provision locally, within the specialist centres, but also out into primary care and into different sectors of healthcare. That the adult teams appropriately refer, that we raise awareness of palliative care, and during transition, I've mentioned that on the last slide. And there's a form called the respect form, so it's making sure that we raise the profile of that as well. So that's just a snapshot of some of the key areas that we talked about. And at the end of the day, we asked everybody that attended to say what they thought their network could introduce into that fontan pathway, having had the conversations that we'd had during the day. So I've added in the numbers here so that you can see the number of people that mentioned these things. And the fontan clinic was the most common, most popular thing across. So there are 11 networks and we had 11 responses to that. So I think that's really important that we have that fontan clinic, and that, you know, that's across all of the different networks. But you can see that other things that we spoke about, other key topics, colleagues from the different networks felt that there were some of these things that they could implement, and some of the centres are already doing this, and there's lots of work happening on some of these things, so like the energy, the spoons, the leg pain care. So I think, you know, this just gives you an idea of things that we've felt that we could start implementing. Now, what we did is during those tabletop discussions around the room, looking at each of the different areas, we asked all of the people sitting at the tables to do post-it notes about the journey and that pathway, right from antenatal all the way through into adulthood. And then each of the tables came up and they stuck their post-it notes upon this timeline here that the team had created. And you can see that there's so much work that took place and conversations that were taking place, and the actions that were identified around all of these different elements. So what are the next steps? So we are feeding back to each of the networks about what we found during the day. We're going to further develop that national collaboration and set some pathways of care. We're going to have a national committee to standardise those pathways. There'll be a national registry. We're working together. There's already work that started to happen following that symposium, working groups looking at specific aspects of the care that we talked about. There'll be more research, and we'll be disseminating the findings of that research as time goes by. We really need to make sure that we continue this multidisciplinary, multi-professional approach across the services, and mental health psychology support is really crucial across all of those things. And I think that's my last slide. And now I'll just open up to any questions. So I'm just going to stop sharing, I think, and then I can see whether there's any questions in the chat. Don't think there are.
I've got a question.
Thanks, Susie.
I've got a question. I want to know what... we had a lot of feedback, didn't we, from the symposium about what is actually possible, you know, because obviously there are lots of constraints on the way that units work, and they're working not just as cardiac units, but often bigger teams doing lots of different things. What do you think that teams need the most to be able to achieve some of the outcomes that they themselves have suggested?
I think the first thing they'd say is time.
Yeah.
Time's precious for all of us, isn't it? We're all really busy nowadays. So having time to work on these projects is essential. Now, I'll just tell you a little bit about things that are happening. So Nigel Drury, who was with us on that day as part of the faculty, has set up a national congenital heart disease research network. And that network will be looking at research opportunities and how we can work together collaboratively across the whole UK to plan research studies and then implement those studies, and then disseminate the findings of that research. And I think working together actually helps us. It enthuses us, it motivates us. It means that we're sharing ideas. So that's one thing. We've also developed, alongside that, another network for research that's for nurses, midwives and allied health professionals, so that we can share ideas and work together. And we do monthly webinars, and we'll have a meeting. And actually our first meeting was in September as well. So I think bringing people together is one way that we can start to address some of these things. But I think finding the time, but because we're all we all really want these things to happen, then actually you do find the time because you're enthused and motivated about it. I can see lots of questions coming through on the chat now, Susan.
Yeah. Can you read them?
So where can I find the symposium video?
They're not available to everybody. They were available to the people, the medical teams that came, because there were some quite controversial discussions, and they wouldn't have had those discussions, I don't think, if patients had been listening to all of the discussion. That doesn't mean that the patient voice isn't absolutely essential, which is why we brought the patient voice into those sessions. But those videos are not freely available. What we might do is go through and have a look and see which actual presentations people would be happy to share, and we will then do that.
Yeah. And then we've got a question about whether all of these different elements will be included in the Fontan clinic. So that's absolutely what we were talking about, is how can we make sure that all of these different elements are built into that clinic so that it's kind of a one-stop clinic, and when you come to that clinic you have access to all of those different professionals, and then thinking about all of those different key topics. So it's not something that necessarily will happen overnight, because as you can imagine that takes quite a lot of planning to get everybody in the right place on the same day. So it's kind of work that we're, something that we're working on, and so that every network has got those Fontan clinics. So going forward, will there be further research into older adults with Fontans? I think there already is some work happening. There's some work around menopause in older women of a certain age. So as an example, I think there's some work looking at dementia, because that's a huge topic for us generally in the population, isn't it? So there's definitely work happening around that. So yes, there will be more work, there will be more research. And if you've got any ideas about anything that we specifically ought to look at, then let us know, because as I say, the patient-parent voice is really useful for us to guide our research in terms of where are the gaps and what do we need to look at. So in terms of NICE guidelines, there are. So we're in the process at the moment. I'm part of a working group for NHSE looking at the national workforce within congenital heart disease. You may well know that there are some standards and service specifications for congenital heart disease that were written in 2016. And the work that we're doing at the moment is to inform an updated version of those standards. So there will be some new standards coming out. NICE guidelines, there are a few available within congenital heart disease, and we probably need to look at what there is available and where we can develop more of those. And I think the idea that Nigel had in terms of setting up that research network is that there isn't a lot of research available within congenital heart disease that we can use to change practice. So it's about us doing more research, and then that informs those NICE guidelines. So should all teams be offering mental health support and palliative care referrals right now? I mean, it might not be happening right now, but that is our, that's our future direction, is making sure that every team does do that. Is there a contact for the research group? If you let Susie know your contact details, Mal, and we'll, because what we're going to be doing as part of that National CHD Research Network is having a PPIE group, so Patient Public Involvement Engagement Group. So if you want to be part of that, and your child wants to participate, please do let us know. So that is something, and Little Hearts Matter will be part of that group, as well as some of the other charities as well.
I think as well, it's also worth noting that when we do collaborate with research projects, or, we have research projects coming to us asking if we have any parents or young people that would like to participate, we do put that onto our social media as well. So if you're part of the parent group on Facebook, you'll see those opportunities there as well as and when they come through.
Thanks, Lexi. Susie, do you want to answer the next one about keep feeling that our children depend so much on us, and especially when neurodivergency is also added to the mix, means there cannot be the same cut-off point for adulthood or independence of the children. How can we get that recognised in the system?
Interestingly, I had a conversation about this only the other week, because I've been sitting on the peer review for paediatric transplant, and I raised the need to be looking at neurodiversity within that group. And the clinicians, although hospitals are quite restrictive about what age someone should be transitioning from paediatric into adult services, clinicians are actually looking to control that slightly more, so that each child between the age of 16 and 18 has more of an opportunity to leave one system and start the next in a more holistic, supportive way. So we absolutely agree that it's not there yet. There needs to be more work done. There needs to be more support for neurodiversity within units, because we're finding that is an issue, less so in paediatrics, but certainly within adult services. That's something that's growing, and gradually, very gradually. So we are absolutely trying to do something about raising the profile of that, and it may be that we can actually get some studies going, some research, and get some evidence base to really prove the point. I know Michelle will probably be able to answer that question as well, because being in the psychology team at the Guy's St Thomas's and the Royal Brompton, there definitely is a greater understanding of neurodiversity, isn't there, Michelle?
There is, yes. Thanks, Susie. I just wanted to totally support what you're saying, but also to add to the question, and that is NICE guidelines are very clear that adult services need to adjust to these different needs or additional needs for people who are neurodiverse or have an intellectual disability. So at the moment, the process through the NHS is that all patients should make the transition around their 18th birthday, but that the provision needs to be made in the adult services. And it's worth discussing that with your teams early, so that they can make sure the provision is there before your child or the young person transitions to the adult service. Thanks.
So there's a question here about palliative care. So I think palliative care is a really sensitive kind of topic, isn't it, really, I guess? And there is a difference between palliative care and end-of-life care, and I guess that's the main thing to point out, is that palliative care is ongoing, and this is why we should be having conversations right at the very beginning, at antenatal stage, about what is palliative care, what does it mean, so that people really fully understand the difference between those two. So your point about you don't want to worry a 14-year-old who's currently thriving post fontan. The importance of the palliative care plan is that that's recognised, but that there are conversations about what your choices might be if things change, and so that each time you go to a fontan clinic, it's not that it's a doom and gloom kind of conversation, that it's about making sure that everybody's heard your views and your future wishes, I guess. So, Susie, I don't know whether you want to add anything into that.
Well, strangely, I'm actually giving a talk on single ventricle and palliative care at a conference on Tuesday. There's a really important factor here. Palliative care is holistic. That's the whole of the child. It's the whole of the teenager. It's the whole of the adult. It's not about end of life, as you've just said, Kerry. It's about ensuring that each individual person with a complex problem reaches their full potential and has all the right support at every stage of their journey. So it's not that they're going to be dooming and glooming it. In fact, it's the reverse. Normally, they'll step away when things are absolutely brilliant, but you have that support mechanism there to go to if you need something put in place for your child or for yourself as you're getting older. So yeah, I think we absolutely think of palliative services as end of life, and it's not. It's absolutely about making the most of life.
Yeah.
Absolutely.
I think as well that's why we want to normalise the conversation, because when you hear that word palliative, straight away it's panic systems because of what you associate with that word. So bringing that word in and normalising it a little bit more and understanding what the umbrella term of palliative means, it hopefully will kind of stop that panic, and you can utilise the services to their full potential as well.
Yeah, and ask questions of the palliative care services at a time where you're feeling okay to ask those questions. I think you're absolutely right. It is about us making sure that there's a clear understanding of what we mean by palliative care. So, is there any more research on fontan and how it impacts mental health? I'm sure that's something that Michelle can probably pick up.
So sorry, I missed that question. Yes.
Is there any more research on fontan and how it impacts mental health and mental health problems that are most prevalent?
Sorry, Kerry.
That's
there
okay.
is the most fantastic paper, but it's published in America by Kovacs 2022. I can put the reference in the chat, which is a massive political push in the US of A for increased provision for people, because they reckon, and this is for people with congenital heart disease, but they reference a lot people who've had fontan, and it goes right through the lifespan, and it's very much part of my presentation later too, thinking about 7 to 11-year-olds if anyone's coming. So I think there is that seminal paper. In UK we are always a bit behind North America, but we are trying really hard to be thinking about this, and thank you for raising the question.
I think also that part of the James Lind Alliance, some of the research priorities that we're looking at, I know certainly myself and Susie pushed hard for the mental health topics to be considered. So there are definitely titles within the James Lind Alliance centering around mental health that we would like to see pushed forward as well, isn't there, Susie?
Yeah, absolutely.
And that possibly links into Sally's question, the next one. Are we all right for time with these questions?
Well, I just carry on for the next. I'll stop you in a moment, but I think
there's only a few more anyway on here. Yeah. So Sally's asked about the have we still got the views expressed by parents at the research priorities they had about 12-14 years ago? So there were 2 research priority events held more recently. So there's one in, I think it was 2018, and then there was another one that was, the papers were published 21-22. So this is the work that Lexi was just mentioning, the James Lind Alliance partnership. So there was one looking at research priorities in congenital heart disease across the board, and there was one that was looking at priorities in single ventricle. And so top 10 priorities were identified from that work, and they've been published. So that's what we're working towards now. I don't know, do you remember one 12 to 14 years ago, Susie? Or
yes. Yeah, I mean there's been all sorts of work, haven't there, been done on the age groups. There's one being done on Joe Ray's just been funded to start looking at a new, because she's been doing a piece of progressive work with children as they grow up, looking at development and neurodiversity and mental health and stuff like that. So that will be a continuation. She's just had funding for the next stage. So there's lots of stuff going on around looking at the whole child, not just the heart side.
Yeah.
I think that's where the change has come, hasn't it? In the last, I would say 5 to 7 years, there's been a change in not just looking at the heart and maximising the function of the heart, which they still need to do, but looking at the whole child. And I think it's really important that we do that.
And that actually links to the next question from Rome, which is about, is the work being done looking at comorbidities with our children? So, yeah, and as you say, Susie, I think, and we are behind the USA, as Michelle mentioned, and, going to kind of international conferences, you hear about some of the work that's happening in other countries, and we are kind of behind them in doing some of those things, but actually, it doesn't mean that we're not doing them. We're just behind that. There's different opportunities.
Got the dates right. She might have got the dates wrong, and she thinks it was a 2018 event, and I think she might be right, because me and Susie were with her at that event in 2018.
Yeah.
2018.
Sorry, my dates. Not
yeah.
Yeah.
And then, I think it was the 2018 one. Yeah, okay. And then one of the challenges found as fontan mum and integrated healthcare is lack of awareness of dental.
Yeah.
So yes, dental work. Let me just read the rest of it. Very much understand private practice. Now 2 dentists, both experienced illicit subjective respiratory glomerular. Yeah. So dentistry is definitely a kind of say growing area within congenital heart disease. So actually Birmingham have just recently employed the first specialist dentist for the CHD network, and she is doing some amazing stuff looking at availability of dentistry for children. She's looking at children with congenital heart disease around that's obviously the West Midlands network, but there are a group of specialist dentists. If you go onto our Congenital Cardiac Nurses Association website, we've actually got a page on there for the dentists. We do need to update it. It's a bit out of date, and probably in terms of who they are. But each of the networks has got a link to a specialist dentist in the specialist centre. And they are doing some work around certainly around we published a study around staff experiences and staff knowledge about dental health care, but there's other studies that are happening now around congenital heart disease and dentistry. So I think we'll start seeing some results of that in the next few years, won't we?
I think there's been an awful lot of change within the medical fraternity and the dental fraternity about what added support should be available for children, teenagers and adults with congenital heart disease. I mean, the issue around whether you do give antibiotics, whether you don't, believe me, there's been an argument between the 2 different specialties about what they should do, and now there's a leaning back towards giving antibiotics more often than there was before. So keep your eye on things. We'll provide you with the link for the North American research, Rowan. We'll do that. We'll bring it up. Okay. We'll post it out into social media. Kerry, I'm going to have to...
I think that's it, really. But only just said about being an issue in terms of lack of awareness for healthcare professionals that are not specialists. And yes,
we sadly we know, and it's just about raising awareness wherever we can. Yeah. Kerry, thank you so much, and
you're welcome.
Thank you for all our delegates for raising so many interesting questions. There's many things that will still need to be answered as we go on, because that as life moves on, we change the priorities. I'm now going to hand over